Recently, with advances in technology and also the post-pandemic period where connectivity is very digital, as an orthopedic surgeon, I've found that the kind of conditions that we are seeing, some are becoming much more frequent. Overuse of the hand and wrist to scroll or text when using smart devices, I have noticed in my practice, has caused an increase in certain conditions like a trigger thumb or finger, another condition called the DeQuervain tendinosis, and also some cases of arthritis of the thumb. Welcome to Health for the Spirit, Soul and Body podcast, where we teach simple concepts and practical ideas we can apply to our whole being to keep us in good health. Before we go on, please support us by taking a few seconds to like this video and subscribe to our channel for more messages. What is a trigger finger or thumb? A trigger finger or thumb is, as I said earlier, that painful finger that locks, catches, or sticks when it is bent. It can affect any finger and can affect more than one finger at a time. Now, this condition can also occur in both hands at the same time. It can also occur in more than one finger in the same hand. If it happens in the finger, it's a trigger finger. If it happens in the thumb, it's called a trigger thumb. There is a medical name for it. As you know, we like to use a particular scientific name for each condition. For trigger finger or thumb, it is called a tendinosis. What are the symptoms of a trigger finger or thumb? One of the symptoms is a locked finger that you can't straighten. So the finger can get locked and you cannot straighten it. For a few patients who come late, they have a straight finger that they cannot bend. Another symptom is soreness or a bump that you can feel at the base of the finger, also associated with pain. Another symptom you could have is a painful clicking or snapping when you bend or straighten your finger. You could also have a popping or clicking as you move the finger. How does trigger finger occur? Now, looking at this line diagram I have done, you will see that the fingers of the hand are bent by muscles. I've illustrated it with these red illustration here. This is the muscle belly for the thumb here going to the tip, while for the fingers it all goes to the tip. So the muscle belly controls the finger through these tendons being illustrated. Now, because of the length of the tendons, there are certain pulleys or bands that hold the tendons down so they can be able to function more efficiently. So there is one in the wrist, and there are several in the palm and in the fingers. Now, in certain situations, the bands get inflamed or the tendons get inflamed and they get bigger than usual, as illustrated in this index finger here. Now, when that inflammation occurs, as the tendon crosses the pulley, it could get trapped in one direction or the other. Now, as an illustration, if you look at this diagram, you once again see the muscle belly, the tendon passing through pulleys to the tip of the finger, in this case, the little finger. Now, so these pulleys hold the tendons down. Now, let's look at another scenario. In this situation, when the fingers are bent, if there is no pulley holding it down, the tendency is for the tendon to go across to the finger like the string of a bow. So the pulleys would hold that tendon down normally. So that's the function of the pulley that gets inflamed. Who are those more likely to have a trigger finger? It usually shows up around the middle ages, between 40 and 60. It is more common in women than in men. And this is more due to hormonal changes that happen around this age. Certain health conditions predispose us or can predispose one to having a trigger finger. For example, diabetes, gout, rheumatoid arthritis. Certain jobs predispose people more to trigger finger than others. For example, farmers, industrial workers, musicians who use their fingers, or anyone who does a repetitive finger and thumb movement. How does a doctor diagnose a trigger finger? Now, the diagnosis of a trigger finger is usually clear after a physical examination of your hand and fingers. Treatment. For treatment, it will depend on how severe the symptoms are. In the early stages, just simply resting the hand from the repetitive movement may be able to make it resolve. And so somebody who is playing a lot of games, using the computer a lot, may just rest from the activity for a little while. If the person can't quit from the activity at that time, if it's a manual work that involves the hand a lot, one could use padded gloves, which will help. Aside from this, splinting the particular finger can help to reduce the incidence. If you use a splint, many times the inflammation may reduce. A lot of times it does not. It is not advised to use the splint for too long a period, as it could make the finger go stiff. Another line of treatment is the use of NSAIDs for short, which is non-steroidal anti-inflammatory drugs or medication. Your doctor may suggest over-the-counter NSAIDs or prescription NSAIDs. Now, things like ibuprofen may help by decreasing inflammation in the pulley that is involved. Another line of treatment, if resting or splinting or NSAIDs don't work, is a steroid shot or injection right at the point of the pulley, which will be a swelling, either in the thumb or in the fingers. This is usually a potent anti-inflammatory medication, which then reduces the inflammation and for many cases will stop the clicking. If the injection doesn't work, the next phase of treatment is surgery. There are two types of surgeries which could be done. The first is a minimal access type of surgery, which is called percutaneous release of the tight tendon sheath. For this, the palm of the hand is numbed and a particular size of needle is used to cut through, just gradually split the thickened pulley that is holding the tendon down. When this is done, it will release the triggering of the finger. In some cases, it could reoccur. When it's much more severe, a trigger finger release surgery is done. And in this case, a small cut is made in the skin and the tendon sheath is officially released. Since it's only one pulley that is released, the other pulleys will still hold the tendon down and it will still be able to function. This usually solves the problem. And so let's remember that if we have this popping, sticking of the fingers, we should seek medical help, as we might have a trigger finger which is eminently treatable. If you gained something from this teaching, don't forget to like it, subscribe to our channel, and share with others. Thank you.